I'd like to give you an overview of disability measurement and the tools that have been developed by the Washington Group on Disability Statistics. And I think I'll start by just giving you a brief background on the state of disability data. In the past, disability data were of poor quality and varied dramatically cross-nationally. The Washington Group on Disability Statistics has developed and tested a variety of tools for collecting reliable, meaningful, and internationally comparable data that have been used by a growing number of countries. These tools can be used to monitor the UN Convention on the Rights of Persons with Disabilities and disaggregate the Sustainable Development Goals if incorporated into national statistical systems. Resources and training opportunities exist to support the implementation of these questions. I'm going to refer to a diagram of the model that we used for developing these questions. This is the model of disability developed by the WHO in the International Classification of Functioning Disability and Health. And what this model shows is the complexity of the disability phenomenon in its entirety. And because of that complexity, countries were asking questions about disability in their surveys and censuses that didn't reflect a more social model of disability, but reflected a medical model. They asked questions like, do you have a disability? Yes or no? And because disability is sensitive to stigma and discrimination, there was underreporting of disability, so that in lower developed countries, less developed countries, the prevalence of disability historically was less than 5%, sometimes less than even 2%. While in high-income countries that approached disability more through a social model, and I'll talk a little bit more about that later, disability prevalence rates were above 10%, sometimes 15 or 20%. So the results we get from surveys are a reflection of the kinds of questions we ask, and that's important to remember. The challenge faced by the Washington Group is that it's not possible to write a short set of survey questions that can adequately and accurately capture all the intricacies of that ICF model of functioning. That's a very complex model, and it needs a lot of questions in order to capture all of it. And yet, survey questions must be short, clear, and precise. So we're confined by the number of questions we can ask in order to capture something that's big and complex. And as a result, many problematic types of questions have been used in the past. And as an example, I refer to the 1990 census in Zambia. And I'll come back to Zambia again a little later. But in 1990, in Zambia, on their census, they asked the question, do you have a disability? In their census. So it was asked of everybody. And the prevalence of disability in Zambia at that time, in 1990, was 0.9%. By asking a question, do you have a disability, what we're capturing is a medical model. It informs disability through conditions like they refer to blindness or deafness or being crippled, terms that we wouldn't use today in collecting disability data. So the Washington Group, our objective was to develop questions that captured only a part of that ICF model, because we couldn't capture the whole thing, but that could be used in an important, meaningful, and internationally comparable manner. And that's important to remember. We weren't developing questions for any particular country or survey, but they were meant to be used everywhere around the world. Now, while the questions may only capture part of the social model of disability, and I'll talk a little bit more about that, they can be used in conjunction with other data that's collected on surveys in order to fulfill the fullness of the social model of disability. The Washington Group on Disability Statistics evolved from an international seminar, a UN international seminar on the measurement of disability in 2001. And it was at that seminar that it became clear that there was no uniformity in the collection of disability data internationally. As I explained, low and middle income countries were producing prevalence rates well below 5%, while high income countries were producing much greater prevalence rates. There was no consistency and no comparability among countries. So the Washington Group was established as a city group under the aegis of the UN Statistical Commission to address the need for population-based measures of disability, to foster an international cooperation in the area of health and disability statistics, to produce internationally tested measures to monitor the status of persons with disabilities, and to incorporate disability into national statistical systems. That was really important. Just a little bit about the Washington Group. The Washington Group is country-driven. Country national statistical offices are members of the Washington Group, and they're the ones who drive the program. Right now, there are over 133 countries and territories who are members of the Washington Group, and they form the work groups that carry out the actual work that we do. There's a secretariat, a small secretariat for the Washington Group, where I work at the National Center for Health Statistics in the US. And we have built an emphasis on evidence and transparency with extensive testing of our data collection tools in multiple countries, so that we want to make sure that they work not only in English, the language that we use to develop the questions, but they can be easily translated into any language for use in any country. I talked a little bit about this social model of disability. And what that does really is it conceptualizes disability as an outcome of the interaction between a person's functional limitations, their difficulty doing basic universal activities, and an unaccommodating environment that results in an inability to fully participate in society. That's what disability is. It's a person's ability to function, their environment, and their ability to participate. All of that are elements of disability. But it's not a medical diagnosis or a condition. It's not based on any medical diagnosis, and it's not an impairment. It's this social configuration, and that's important. Disability, because of that definition, may be a complicated construct, because it does incorporate all of those elements, all of those components, body function and structure. So how your body is put together, limitations in activities or your capacity to do things, and restrictions in participation or your performance, taking into account the environment. And it includes personal characteristics and environmental factors. The language of disability is not specific. It's very broad. And finally, and perhaps most importantly, in some cultures, stigma is associated with disability, creating additional challenges to the measurement and ultimately to inclusion. So the Washington Group defined an approach to measuring disability that's based on identifying those who, because of difficulties in these basic universal activities, are at a greater risk than the general population in limitations in participation if the environment they live in is unaccommodating. So we're only focusing on the difficulties that people have that put them at risk. So going back to that challenge, how can we measure the broad experience of disability through a limited number of questions in a consistent manner and in a cross-culturally comparable way? And what we came up with first was a short set of questions. a set of 6 questions, and these cover 6 domains of functioning: difficulty seeing, difficulty hearing, difficulty walking or climbing stairs, difficulty with cognition, like remembering or concentrating, difficulty with self-care, like washing all over or dressing, and difficulty communicating, for example, understanding or being understood. And each of those 6 questions comes with 4 response categories: no difficulty, yes, some difficulty, yes, a lot of difficulty, and I cannot do it at all. So what we've been able to do here is we've been able to begin to describe a continuum of functioning, because disability isn't inherently that dichotomy: are you disabled, yes or no? But it describes everything from I have no difficulty doing any of these things to I cannot do any of them at all, and everything in between. And that's what we want to be able to do, is to begin to describe that continuum of functioning, and then using the data we've collected to construct a dichotomy that can be used for disaggregating the SDGs and monitoring the convention. So now I want to go back to Zambia for a second, because remember, when they used that medical approach to collecting disability data, they asked, do you have a disability? They got a prevalence rate of 0.9%. In 2006, 16 years later, I was in Zambia, and we carried out a survey of living conditions among people with disabilities and people without disabilities. And we used those 6 Washington Group questions. And data analysis showed that the prevalence of disability was 8.5%, which is probably much, much more realistic than the 0.9% that was achieved in 1990. So the objectives of that short set of questions are to identify persons with similar types and degrees of limitations in these basic actions, regardless of nationality or culture. So we're looking cross-nationally. We want to collect information that represents the majority, but not all, persons with limitations in these basic actions. Those 6 domains of functioning don't cover the entire range of functioning capable by a human body. So what we focus on are those that will give us the majority of cases. They represent the most commonly occurring limitations in domains that can be captured in a census context, because that was our first goal, to look at questions for a census. The data are meant to be used to compare levels of participation in employment, education, family life for those with and without disabilities, and to determine whether or not people with disabilities have achieved social inclusion. Now, those questions don't include information on employment or education or family life, but most surveys do have that information. We're only providing the disability identifier through those 6 questions. And that way we can monitor the effectiveness of programs and policies that promote full inclusion. And we can monitor prevalence trends for persons with limitations in these specific basic action domains. There are advantages to using the Washington Group questions. They focus on this functional approach to disability. We're not talking about conditions or diagnoses, but a person's functioning that might put them at risk of not being able to participate. They've been tested successfully in many countries, low, middle, and high-income countries, in multiple languages. So we have the evidence that they are applicable in all of these situations. So they're designed to be internationally comparable. They identify, as I said, most people with disabilities, but not all. And they can be easily added to existing censuses and surveys or to project-based data collections. They only take about 1.25 minutes to ask of one individual, so they're fairly easy to use and quick to use. But again, they're not without limitations. They're not appropriate for children under the age of 5, and they will miss some children with developmental issues aged 5 to 17. Under those circumstances, we strongly recommend the use of the Washington Group UNICEF Child Functioning Module that focuses on those specific age groups to collect more reliable data. The Washington Group short set of questions will miss people with psychosocial issues that aren't affected by communication, cognition, or self-care. Those domains will identify some people with psychosocial issues, but not all. We won't be able to capture the age of onset. That's something that would need to be added to a data collection. And we don't include information on environmental barriers. Again, those are questions that would need to be added to a data collection system. The Washington Group short set of questions has been adopted by a number of organizations and countries internationally. UNICEF has included the short set of questions on their multiple indicator cluster surveys for women, adult women and adult men. USAID has included a module on disability and functioning that's very much in line with the short set of questions for their demographic and health surveys. And the World Bank is scaling up the inclusion of the Washington Group short set into future World Bank-sponsored household surveys, including the Living Standards Measurement Surveys, their LSMS. The Washington Group questions have been used on censuses and surveys in over 75 countries to date. And they have been promoted by international aid programs like DFID, the Department for International Development in the UK, and DFAT, the Department for Foreign Affairs and Trade in Australia, as a means to collect disability data in all programs and projects. They've been introduced as the means for collecting disability data by the UN Statistical Division and the UN Economic Commission for Europe for the 2020 round of censuses. And the Washington Group short set has been championed by DPOs, disabled persons organizations, and NGOs internationally, in particular the International Disability Alliance, Humanity and Inclusion, Sightsavers, CBM, and others. But because the short set of questions doesn't cover entire populations or the entire scope of functioning and disability, the Washington Group went on and developed an extended set of functioning for adults that was adopted in 2010. It looks at more domains of functioning, gets into more details about functioning with and without the use of assistive devices in some cases, but includes as many as 35 questions. So it's a lot more to add to a survey. Again, because child functioning and disability isn't adequately captured by the short set, we partnered with UNICEF to develop the Child Functioning Module for children 2 to 4 and 5 to 17 years of age that looks at those specific developmental issues that most affect children and might lead to developmental delay. We're also partnering with UNICEF to develop a module on inclusive education. Here we go one step further and don't only look at functioning, but we look at participation. All children have the right to an education, so we use that as our end point. And we want to find out why children might not go to school. What are the barriers to education? And that module is under development. And in the same way, we're looking with the International Labor Organization at employment. Something for adults. Not all adults work, but most adults do work, and we're looking at a disability module for labor force surveys to look at participation and barriers to employment among adults. So with these tools, we've begun to fulfill that model of disability and functioning that I showed you initially, that ICF model that looks at capacity in terms of difficulty functioning, and now with the inclusive education module and the labor force survey module, we're looking at participation, two important elements of participation for children and adults, and then looking at the barriers, the environmental barriers to participation. And together, these survey tools will fulfill an overall disability module for data collection on persons with disabilities. So I'd like to conclude by just tying all of these data collection elements together. We have the short set of questions, we have the extended set of questions, the child functioning module, and we're getting into participation and the environment through the inclusive education module and the module for labor force surveys. And what these will do is fulfill that full model of disability that was laid out by the International Classification of Functioning, Disability, and Health. Using these tools together will give you that complexity of disability that any one element wouldn't be able to fulfill.